we're going to talk about what happens when you have hypertension, what symptoms and downstream effects can it have on your body. We'll also discuss what hypertension actually is and what causes it. So let's get going. When we talk about hypertension, we're actually talking about high blood pressure in the arteries. So your blood vessels are divided into arteries and veins. Generally, the arteries are under the high pressure pumping effect of the heart, and the veins are actually not as pressured compared to the blood vessels. So when we're talking about high blood pressure, we're really more concerned about the arterial side of the picture. And this can lead to various health complications if we leave it untreated. There are different causes. Poor diet, if you're not doing any exercise, excessive alcohol intake, stress can all contribute to the development of high blood pressure. And of course, if you have medical conditions such as kidney disease, problems with your thyroid, sleep apnea, all of these things can also increase the risk of high blood pressure. Now let's go back and look at those blood vessels, in particular the arteries. We can think of them as garden hoses, and you can imagine the blood flowing through the hose. When you pinch the hose, you're going to make it narrower, you're going to constrict it. And this increases the water pressure inside, right? So in your blood vessels, when you narrow those blood vessels, you're increasing the blood pressure. We have muscle cells in the wall of the blood vessel. So that would be basically in the rubber part of the hose. And those muscle cells can contract, and as a result, they can narrow the blood vessel, increasing the blood pressure. Now, when you get your blood pressure measured, you'll see that there are two numbers involved. The top number is called the systolic pressure. This tells you how narrow the blood vessel is. So the narrower the blood vessel, the higher that number, the higher the pressure in the blood vessel. And that's what the systolic number means. What about the bottom number, the diastolic number? This tells you how stiff your blood vessel is. So let's compare a concrete pipe and a garden hose made of rubber. As you can tell, the rubber has just more give to it, right? Whereas the concrete pipe is very stiff. So your heart is pumping blood into these vessels. And if the vessel is very stiff, if it's like a concrete pipe, then the heart has to work harder because it's pumping really hard against the blood vessels, right, to get the blood flow going. Whereas if you have a more sort of flexible blood vessel that is made of rubber, then the heart, as it pumps, there's some give to the blood vessel. It doesn't have to work as hard. So the blood vessel is very important. The state of the blood vessel is very important towards the health of the heart. Now, if you have a blood vessel that is stiffened due to the deposit of extra collagen and connective tissue, and also calcium deposits, you're going to make the heart work a lot harder because the stiffer the blood vessel, the higher that diastolic bottom number. What are some of the symptoms that come about with hypertension? Well, some people can get headaches. Persistent or severe headaches, especially in the morning, can be a sign of high blood pressure. Some people will experience, feeling lightheaded or dizzy. And some people may even develop chest pain or complications due to untreated high blood pressure. Now, you could also get shortness of breath when you're engaged in any kind of physical activity. When I tell people this, a lot of times they start panicking. They go, "Oh, I was a little dizzy when I got up. Oh, I was short of breath when I was, playing football with my friends." So, the main thing to do is to try to relate some of these symptoms to your actual blood pressure. So it would be worth investing in a blood pressure cuff, an automatic one that you can purchase in the store. When you're experiencing, let's say, headaches, when you're a little dizzy, it's a good idea to check your blood pressure and see how it relates to that symptom and record it. And this is something that you can then share with your healthcare provider. The most important thing for you to remember is that many, many, many people don't have any symptoms when they have hypertension. So they're not even aware what's going on in their bodies. They're not even aware that they have high blood pressure because they just kind of go about their day feeling normal. But this doesn't mean it's not impacting your body. This doesn't mean it's not causing any damage in your body. And that's why it's really important to pay attention, because if you don't treat, if you don't diagnose and treat high blood pressure, you could end up with cardiovascular disease, because this can lead to heart attacks, heart failure, other heart problems. It can also lead to kidney disease. When your blood pressure is high, then you're going to damage the kidneys. Now, you think of the kidneys in your body as filtration devices. They filter blood and convert it to urine, which you can then, remove from your body when you pee out. So when the blood pressure is high, then the blood vessels that are supplying the kidneys would be under high pressure, and this will damage the kidney tissue itself. And when that happens, you have decreased kidney function, and that could ultimately lead to kidney failure. High blood pressure is also related to stroke. So if you have untreated hypertension, you would be at an increased risk for different types of strokes, and that would be quite debilitating. You can also have vision loss if you don't take care of your high blood pressure, and this is because you damage the retina and the optic nerve, which is the main nerve that supplies your eye. Let's just focus on cardiovascular disease right now. So when you have high blood pressure that's not treated, it can lead to the buildup of plaque. Plaque would be these fatty deposits in the blood vessel wall, and they can cause damage to the artery wall and increase your risk of heart attack. You would also be at risk for heart failure. And that's because, again, when you have high blood pressure, you're forcing your heart to work very hard. You are actually causing it to be under a lot of strain. And that can weaken and damage the heart over time, leading to heart failure. You could also develop an aneurysm. So, again, when the blood vessel wall is under high pressure, it starts to weaken from the pressure and it starts to balloon out. So if you think of your garden hose, you can see that, it might kind of bulge out in certain areas over time as the wall starts to weaken. And sometimes it can even pouch out and form almost like a little balloon. And we call those little pouchings aneurysms. And if those get big enough, they are at risk for rupture, which means they break. And that would lead to internal bleeding, and it could be fatal. So you don't want to risk an aneurysm if you have uncontrolled high blood pressure. Hypertension also leads to arrhythmias, which are life-threatening in some cases. An arrhythmia is an irregular heart rhythm, and we see people develop arrhythmias when they don't have their hypertension under control. Now, what about kidney disease? I mentioned to you how high blood pressure will damage the small blood vessels in the kidneys, and you get kidney dysfunction as a result. Normally, you shouldn't be peeing out protein in your urine, but because the kidney is now damaged, it's going to start to leak substances, and one of the things it will leak will be protein. So if we start to see protein in the urine, it's never a good thing. It's always a sign of kidney damage. So if you hear that you have proteinuria, if your doctor tells you that, it means you have kidney damage. And if you're not going to protect your kidneys, ultimately you could get to a point of complete kidney failure. You might require dialysis and eventually maybe even a kidney transplant. So what about stroke? You could have different types of stroke. Ischemic stroke is caused from blocked arteries, and this again could be due to the buildup of these fatty deposits in the artery. So it ultimately blocks the blood flow, and you get ischemic stroke, which means you don't have enough blood flow to the brain, and you would get a stroke as a result. You could also have a hemorrhagic stroke, which means that you are going to have a bleed in your brain. And this is because the high blood pressure is going to weaken those blood vessels in the brain and cause those blood vessels to burst. And as a result of that, you're going to bleed into the brain, and this could be very life-threatening. Strokes are bad because it's going to lead to brain damage. Often, some of these deficits will be permanent, and we're going to have disability, and in the worst case scenario, death. So once you've been diagnosed with high blood pressure, there are many things that you can do to get your pressure under control. And if you haven't been diagnosed yet, there are many things you can do to prevent that. So let's look at diet. The main thing I would advise is to cut out processed foods, cut out sweetened beverages, the sodas, and also the juices. Juice is not healthy, right? Cut out the juices as well. Now, when it comes to salt intake, sometimes people are confused because if you take too little salt, it can cause problems for your heart. If you take too much salt, it can cause problems as well. So generally, we advise people to limit their salt intake to about 1 teaspoon a day, which is about 5 to 6 grams of salt. All right, so you don't want too little. You don't want too much. You want that balance right in between. What about exercise? We do recommend regular physical activity. Now, you can start with walking and then increase the pace over time. Ultimately, to be healthy, you would need other forms of exercise, but just starting with walking can be very helpful to reduce your blood pressure. What about stress management? Very important because when you are under stress, what happens is that your brain sends signals to your blood vessels, and also you secrete adrenaline, and this will constrict the blood vessels or narrow those blood vessels. And you know by now that is going to raise your blood pressure. So using stress reducing techniques such as meditation or yoga could be very helpful to manage your blood pressure. Do have regular checkups. Check your blood pressure with a common blood pressure machine that you can buy in the store. Check that to see where you're at. And, when you notice numbers that are in the higher range, make sure to discuss that with your provider and understand that the earlier we pick this up, the earlier we can start treating, and that will help you decrease all the downstream negative effects of high blood pressure. Most importantly, this always gets missed, so I'm going to emphasize this. Get a sleep study. Even if you're not snoring, even if you don't have obesity, even if you don't have a high BMI, get a sleep study because I find so many people come to me and they've had high blood pressure for years and they're on 3 medications and still their blood pressure is not well controlled. And when I checked, they've never had a sleep study done. So when I send them, inevitably they have, sleep apnea that's not being treated. You will not treat your hypertension if you have untreated sleep apnea, and that can have really bad consequences on your health. So I'm going to emphasize again, get a home sleep study at the very least. Talk to your provider about doing that. I hope this was helpful. And if you have any questions, make sure to put it in the comments, and I'd be happy to try and answer some of them for you. All right, take care. Bye.